Hi, welcome back. This is Dr. Cash at Dr. Cash Medical and Life. Today I will be talking about atrial fibrillation, how it is treated. So now let's go ahead and talk a little bit about the treatment aspect of atrial fibrillation. Now, there are several important components that we should focus on in terms, or main components that are important in the treatment. Number one would be rate control. Number two would be rhythm control. And number three, anticoagulations. So I'll go over each of these separately and slowly. Now, rate control is very important. It's quite important in that a normal heart rate usually runs in the 60s to 90s. Okay. Now, with atrial fibrillation, because of the extra electrical activities that are signaling out from the atrium, and that translates into the heart beating as well. The heart rate can ranges from the normal range to even 200. And so we know that particularly at the higher rate, in the mid 100s to 200s, the heart is quivering with ineffective pumping. And a lot of time people don't feel good. They get nauseated, they have chest pain, they get short of breath, they feel dizzy. And so it's important to control the heart rate to get it down to as normal as possible. And this can be achieved with medication. Initially, this is usually done with IV medications to bring the heart rate down through a drip, and then it subsequently switch over to a tablet medication or a capsule medication for the long-term management of the heart rate. The goal is to, again, get the heart rate to as normal as possible from the 60s to the 90s. Now, the next component of treatment for atrial fibrillation is rhythm control. And because of the aberrant electricity that is flowing from different part of the atriums and signaling and giving these mixed signals, the heart is not pumping in its usual manner. In the usual manner, you have one spot, the pacer, the natural pacer of the heart, that send its signals, and then it will travel through certain channels of the heart. And once it has traveled through those channels, then it will then cause the heart to contract and to work in a very orderly manner. But with atrial fibrillation, you have the natural pacer, and then you have these other activities that are happening all at the same time. So they're not in sync together, and then you will have this irregularity of the pumping of the heart. And so one of the goals is to control that rhythm if possible. If the rhythm is irregular and causing poor circulation, resulting in severe symptoms such as hypotension or low blood pressure, or if the patient becomes super dizzy and is just miserable, one may wish to cardiovert or to use a device to shock a patient to out of that rhythm into regularity, hopefully. And that's successful to some extent. Once the patient is shocked out of that irregularity or atrial fibrillation, then a medication can be instituted to keep the patient in rhythm so it doesn't keep going back and forth. Okay. Now, sometimes this by being shocked out of that rhythm into regularity again, or be put on medications, patient just keeps going back and forth or just staying in atrial fibrillation, then one may wish to, in the appropriate setting, get the patient in to see another specialist, electrophysiologist, where they can actually use a catheter to go into the inside of the heart and localize any of those extra blip of electrical activity and zap them to prevent these other extra electrical locations to so that to prevent atrial fibrillation from happening, and that again has its limits in success rate. Now, finally, the last component, but also equally important, or it's even most important, is anticoagulation. And again, one of the main complications or problem with atrial fibrillations, in addition to the symptoms that a person can experience, such as chest pain, palpitation, dizziness, short breath, and such, is a complication of forming blood clots in the heart. And again, this is where, because of the irregularity of the heart, it's not pumping out properly, and then you have stasis of blood, or blood that does not move, and then as a result of that, you have clots forming. And so again, as a result of that, those clots can travel into the brain to cause a stroke, or other locations of the body to cause whatever problems that organ is functioning. So it's certainly important to prevent that process from happening in terms of clots. So usually there are several different medications that are used to prevent clots from forming. Traditionally, Coumadin or warfarin has been used for a long time, but that usually, again, require a lot of monitoring, blood checks, and such. And so a lot of people don't like it. More recently, there are medications such as Eliquis, Xarelto, Pradaxa. Some of these medications do not require finger sticks or frequent blood draws to monitor their levels, and so a lot of patients prefer these. However, these medications are quite expensive and pricey, and depending on if you have any contraindications such as renal failure or some other problems, warfarin may still be the mainstay of treatment for you. So only you as a patient and your doctor can make that decision. Can depend on price, or cause, or other contraindications. Well, I hope that today you have learned some useful information about atrial fibrillation, so what it is, what are some of the symptoms, and how to treat it. And if you have any comments, questions, concerns, please put down in the comment section. And I hope to see you again next time. Have a good day.